The title of today's class is Voluntary Obesity and Voluntary Diabetes. Voluntary obesity and voluntary diabetes. That's got to be almost like an oxymoron. What do you mean voluntary obesity, voluntary diabetes? Who would voluntarily choose these things? I'm going to make a distinction between voluntary versus involuntary diseases. For instance, type 1 diabetes in an infant, they're born with it. The beta cells in the pancreas are not producing enough insulin. They have type 1 diabetes. That's involuntary diabetes. With there's involuntary diabetes, but there's involuntary diabetes exacerbation of existing diabetes, making it even worse when they have it. Started really catching on to this when I was at a restaurant. I'm going to use this as an example. I'm at a restaurant, a family restaurant. We're outdoors eating, and started talking to the gentleman at the next table. He has 3 or 4 children around him. I'm sitting there with my wife. He starts talking to me that he has diabetes. And in fact, his blood sugar level is 300. Anything over 126 is considered diabetic. A blood sugar level of 300. He was on, I think, either metformin and some insulin on high dosages. So we talked for a while. Then I ordered my meal, sitting there, we're eating. He starts eating, and then he orders. I see his order coming in. And it's a big stack of pancakes, white pancakes with white flour. And then I see him pouring syrup all over the pancakes. I look at him, I say, hey, brother, I don't want to interfere with your business, but you just told me you had diabetes, right? I said, you're killing yourself. And he said, I know, but I just can't resist it. I know, but I just can't resist it. He's a good archetype of voluntary diabetes. So there's 2 types of voluntary diabetes. There's where you have knowledge, with knowledge you're voluntarily doing it, but then you have people who just don't know, they don't have the knowledge, and they're doing the wrong things, but they didn't know any better. I'm particularly focusing on conscious voluntary diabetes as opposed to where people do it out of ignorance, because it's epidemic. And when we talk about voluntary obesity, because most people know what are high glycemic carbs, what's going to make them heavy. They know that most people have that knowledge. They know about it. But yet they're choosing to become obese. And the obesity is a gateway condition into all the major diseases in the world. It's a gateway disease to diabetes, gateway condition to cardiovascular disease, to cancer, to arthritis. It's a gateway condition to the major killers that we know of. Yeah, involuntary obesity, for instance, could be due to postpartum condition or hormonal imbalances. Women going through menopause, you eat very little bit, the hormones are off, they just gain weight. Well, that's involuntary obesity or involuntary overweight. You have, say, involuntary cancer. You know, asbestos, where people working in houses had asbestos, they didn't know it was going to cause cancer, and years later it comes out that was causing cancer. That's involuntary cancer. Somebody who's smoking and comes down with bladder cancer, well, that's voluntary cancer, because that's known to be a major factor for bladder cancer. So it's voluntary cancer. So we're looking at, well, what causes voluntary diseases? And what are the implications? For example, somebody who has voluntary diabetes and needs an organ transplant, because you don't die of diabetes, you'll die of a heart attack or stroke. So let's say somebody needs a heart transplant, and you have a patient who's a voluntary diabetic. And you have somebody who was in a car collision and needs a heart. Both need the heart transplant. The question is, who should have priority? I mean, all else being equal, who should have priority? The involuntary condition or the voluntary condition? I'll ask you. What do you think? Who should have priority over the heart transplant? Someone who is a voluntary disease, or somebody who's in a condition that was not voluntary? They're not voluntary. The involuntary one should have priority.